In January, the nation reported its first COVID-19 case. At one point, the daily infections surged up to concerning levels. 3 months into the pandemic, South Korea is earning praise for fighting the virus and putting a lid on the outbreak. For now, Dami looks back on the last 100 days.
South Korea confirmed its very first COVID-19 case on January 20th. About a month later, there was a shock nationwide when the 31st patient turned out to be linked to a cluster of 800 infections centered on a religious group called Shincheonji. At the same time, there was another cluster at a hospital near the city of Daegu. But thanks to the strong social distancing measures put in place from March 22nd, the country has gotten the virus under control. On this Tuesday, South Korea reported just 14 new cases. Around 1,600 people are being treated for the virus, and the death toll stands at 244. In fact, 60% of the daily confirmed cases for the past 2 weeks have been imported. The country's safe, effective COVID-19 testing capabilities, such as drive-through testing, also helped tame the virus. Having expanded the number of testing facilities from just 68 to almost 120, South Korea can now do around 23,000 tests a day and has so far tested well over 600,000 people. However, the health authorities warn that it's still too early for people to let down their guard.
Despite our successful quarantine measures, the COVID-19 pandemic is still ongoing. We should not let our guards down for the next 1 to 2 years until the treatment and vaccines are developed.
Expressing deep gratitude to the medical workers on the front lines, the South Korean health authorities have pledged to continue the fight and bring life back to normal. Social distancing measures will remain in place until May 5th, and in the meantime, the government will work on a long-term plan in case there's a second wave. Dami, Arirang News.